Well, among the winners in the market today, one of the few names that were in the green here for most of the day was pharma stocks. Now, they've been getting a boost as the fight against coronavirus continues. Names like Johnson & Johnson, Gilead, and Merck holding on to gains today. Now, as of last night, the U.S. has over 100,000 deaths related to the coronavirus here in the United States. So here to talk more about this, I want to bring in Dr. Amesh Adalja of Johns Hopkins. And Dr. Adalja, we reached that grim milestone. Over 100,000 people here in the U.S. have died because of coronavirus. I just mentioned the potential for a second wave. We had Dr. Fauci earlier this week saying that a second wave of infections is not inevitable as long as Americans do follow the CDC guidelines. I'm just curious what your thoughts are, because when we've spoken in the past, we have talked about the likelihood of a second wave.
You have to remember that this virus has established itself in the human population. It's not going to disappear until there is a vaccine. So whether or not we have a steep second wave with a big peak to it, that's up to our behavior, how well we manage the number of cases that we're going to continue to get as we stop social distancing as rigorously as we have been in the past. This is going to be a challenge, and I do think we have to prepare for the fact that during the fall season, when you have influenza as well as this novel coronavirus circulating together, hospitals could get hit hard, and we have to make sure that they have the capacity to take care of those cases. And they're going to be competing for ICU beds and personal protective equipment and staff, and it will be challenging. And I do think that we have to really drill that into people, that this isn't going away anytime soon.
Doctor, let me ask you about some of the two basic types of drugs that are being worked on, which are the therapeutics and the vaccines. And you know, this is a business show, so we're interested in the companies and businesses pursuing these types of treatments. Some people are saying that if a vaccine is effective, then it means the therapeutics aren't so important anymore. Is there something to that?
Yes, as we get farther into the epidemic or the pandemic. So right now we have neither. So the best way to control an infectious disease is through a vaccine. That's how you eliminate it as a threat. So for example, if we think about measles, we don't have any measles antivirals because the vaccine is so good at keeping cases down to a low enough level. But right now, we don't have a vaccine against this novel coronavirus or against any human coronavirus. So it is really important to have a medication to give people when they are hospitalized with this to prevent mortality. But eventually, if we could have an effective vaccine and eliminate this as a threat, therapeutics would become of less importance because we would be controlling this infectious disease like we do many others through a vaccine.
Hey, Dr. Adalja, Rick Newman here. We talk about stocks going up seemingly every day on Yahoo Finance, driven often by news of some new drug that has come onto the scene or early reports of progress for a vaccine, perhaps by the end of this year. I mean, you've seen all these reports. Could you tell us what is realistic, even with the accelerated timetable, in terms of when we're likely to have a vaccine available to the public?
We are moving at record speed to have a vaccine faster than we ever have before, combining phase 1 and 2 clinical trials, Operation Warp Speed, thinking about manufacturing before we know whether a vaccine works or not. But it's important to remember that vaccine development is something that's usually measured in years, not in months. And it would be extremely optimistic to think that we would have vaccine at the end of the year or 12 to 18 months. I think realistically, we shouldn't be wedding ourselves to any date. I think that 2 years is probably where we would see a vaccine in enough quantity to be able to impactfully control this outbreak. We may have some batches for healthcare workers or high-risk individuals, but I'm not pinning my hopes on having a vaccine before the end of next year.
Okay, so doctor, what are you most excited about? Is it a vaccine or is it a therapeutic? And, you know, we're hearing about, we heard about Gilead. Then when the next week we hear about Moderna on the vaccine side, Gilead on the therapeutic side, Vir on the therapeutic side. Are there any companies or at least particular avenues that you think are most promising?
I do think that the biggest issue is going to be trying to get a vaccine into people. That's where we really change the game with this virus. That's how we remove it as a threat. That's when we get back to normal. Because even if we have a therapeutic, we're not going to get back to normal. You're not going to be able to have mass gatherings in a safe manner. So I'm very excited about vaccines. There are a dozen or more of them that are out there. Moderna is a leader in the United States. There's also companies like Inovio. There's the Oxford group working with AstraZeneca. There is Pfizer. There is Merck. All of these companies are really racing to develop some kind of candidate, and they're using really great technologies that we didn't even have a decade ago. So that's what makes me more excited, is thinking about these vaccines and how they might impact this virus and other coronaviruses. Because remember, coronaviruses as a threat are not going away. We've had SARS, we've had Middle East respiratory syndrome. A vaccine against all of them would be a great, great boon.
Any particular favorite, though?
I don't have a favorite yet. I think that I'm very interested. I think mRNA vaccines are a great platform. I think that they can be scaled up rapidly. They're elegant. Moderna is one company doing it, but there are other companies that have other mRNA vaccine candidates as well. So I do think this is a time for mRNA vaccines to shine.